Good morning, everyone. My name is Kristen Mon. I am the housing coordinator for the city of Tulsa. As the housing coordinator, my role is focused on implementing the citywide housing strategy with a focus on preventing displacement and homelessness in our community. With COVID-19, we are focused on implementing strategies to prevent displacement and ensure safe, habitable rental properties. I'd like to briefly tell you about one of the resources currently available to prevent displacement, the Early Settlement Mediation Program. It is a free program sponsored by the Tulsa County and Oklahoma Supreme Court. The Early Settlement Mediation Program provides free mediation to resolve disagreements between tenants and landlords, including difficulty paying rent and threats of eviction. A mediation is a meeting with a neutral third party to help the tenant and landlord resolve their disputes and come to an agreement that will benefit both of them. Both landlords and tenants are encouraged to apply to this free program as soon as the dispute develops. They don't have to wait to receive a notice or be threatened with eviction. They can apply by calling 918-596-7786. More information is also available on the Away Home for Tulsa website. That is awh4t.org/COVID-19-resources. For our presentation today, our goal is to provide information to tenants, landlords, and community partners on maintaining safety in the home. I want to thank the Tulsa Health Department for sharing their expertise with us and Homebase for hosting and making this presentation possible. As a brief overview of how today's presentation will go, Kendra Wise of the Tulsa Health Department will explain safety precautions for tenants and landlords in multifamily housing to remain healthy and limit the spread of COVID-19. There will be an opportunity for questions. To ask a question, please use the chat feature in Zoom. Everyone is currently muted and camera should be off. We ask that you please keep your mics muted and use the chat function to ask questions. Thank you everyone for attending today, and I will turn it over to Kendra.
Okay. All right. Can everybody hear me? I'm not muted. Okay, good. Hi, I'm Kendra Wise, and I work for the Tulsa Health Department, and I've been there for over 17 years. My department is Environmental Health Services, and we are the group that investigates complaints for housing. We have a mosquito control program, and also new to us, we have a lead hazard control program, and that's the program that I'm in charge of as the lead program supervisor. So you can get more information about all of our programs at the Tulsa Health Department website, tulsa-health.org. So today I am going to talk about basic COVID-19 infection information, update personal protection and the best practices to protect staff and residents. Tomorrow, Away Home for Tulsa and the City of Tulsa are going to present a landlord rights during COVID-19 presentation to answer all of your questions about non-payment, evictions, and offer additional resources to help you through this difficult time. So again, thank you very much for participating in our online Zoom presentation. During the COVID-19 response, THD is committed to our mission, which is to improve the health and well-being of all Tulsa County residents. We are seeing the importance of public health play out before our eyes. So we are probably getting really familiar with COVID-19 by now. You might hear people say that we are still learning about the virus, and we definitely are. I watched a webinar last week that talked about different studies that are happening all over the world. Right now, they're trying to answer all of our questions that we have, from where this started to how we can properly treat it to an eventual vaccination. So we do know that the virus is spread person to person, and that is why we encourage you to stay 6 feet apart. Surfaces may be dirty, and I don't mean visible dirt because you cannot see the virus, but when droplets settle from coughs or sneezes onto surfaces, or surfaces are touched by contaminated hands, this is how the virus is spread in our community. We have been implementing safer at home standards for weeks, and I hope that you can see that we are helping by being so cautious. And if we buckle down in the next few weeks, we can make a difference and not overload our healthcare system. We need to protect ourselves from those silent spreaders. So the symptoms, of course, are the fever, cough, and the shortness of breath. And some people do experience other symptoms. We want to encourage you to call your doctor if you have symptoms. If you do not have a doctor, call 211. And you are considered recovered from COVID-19 if you have been fever-free for 72 hours and 7 days since the symptoms onset, and all other symptoms have improved. So if you meet all three of those criteria, then you are considered recovered. They're not doing tests to say that you're recovered from COVID. One thing that I read an article this morning really defining three types of spreaders that we need to be cautious of. So there's those asymptomatic spreaders, and they carry an active virus in their body, but they never developed any actual symptoms. So you can see how dangerous, that can be to the community. There's pre-symptomatic people that appear to be most infectious about the time that their symptoms start. So just like with other illnesses, there may be like a couple of days where you're like, oh, I don't really know. Oh, yes, I am sick. Okay. Mildly symptomatic, these are the people that are not, their symptoms are not severe enough to really be aware that they are actually sick, and they just power through. And so while they're powering through, they could also be spreading that infection around. And that is why we are really focusing on that personal protection. So of course, you've heard us say washing our hands and not touching our face, and then covering your cough when you sneeze, and then avoiding close contact with people. And so new, as of last week, we're recommending that people that even if they're healthy, to cover their face with a mask. And so it's weird, right? I know it's weird, but my first time to leave the house last week was to give blood, and I put my mask on. I made it out of a bandana and 2 hair ties, just like they show you on the CDC, the health department, and the city of Tulsa videos that we've released out on social media. And I put my mask on, and I couldn't breathe. It was really hard to talk, to answer the questions that the lady at the blood bank had for me. But I wore it again last weekend at the gas station, and it was better. And then I wore it yesterday to the grocery store, and I had no problems at all. I didn't feel like I couldn't breathe. I was able to talk, and I felt more comfortable. And so I hopefully you're feeling the same way, and you're able to protect yourself from those asymptomatic people. And of course, remember to practice your social distancing. So it is very important that we use reliable sources to get our information. So the CDC, Oklahoma State Department of Health, or the Tulsa Health Department, we're always putting out updated info that you can print off and you can share with the people living with your complexes. We update our information often. For this presentation, I reached out to Carrie Cooper with the Tulsa Apartment Association, and she helped me with topic ideas and questions of things that people are experiencing out in apartment complexes, and questions that people might have. And I got a lot of information from the National Apartment Association website and the National Multifamily Housing Council. So residential property management companies are considered essential because you provide people with access to available housing. Maintenance staff respond to emergencies like broken water lines and no heat. And because of this, we need to work together to keep your staff healthy and to still provide this essential service. So, communication, I think, is key. You can post updated info on the doors of your business, change the voicemail for the emergency report line. If you have more staff that are working from home, you can communicate that with the residents. If you have a change in policy for rent, and if you are, or maybe if you're in the middle of remodeling apartments and you need to change that timeline, and what about if you're running low on hand sanitizer because it's really hard to find it? Then you can maybe post information to have residents bring their own to the laundry rooms. So one thing that I thought might be important to share with residents, to not flush paper towels down the toilet if they run out of toilet paper. So these are the types of things that I want you to focus on whenever you are deciding how your company is going to go move forward in the next several weeks. And one thing that we want to stress is that you cannot require that residents tell you that they've been diagnosed or have symptoms of COVID-19. You cannot require that residents tell you that. For staff, yes, it would be nice if they told you so that you could help mitigate the spread, but they do have the option to decline giving you that information. And whenever they do test positive, they're contacted by someone from the Tulsa Health Department, an epidemiologist, and we go over that contact information with, figure out who's been in contact with them so that we can run through our specifics of contact tracing. So again, we cannot ask the residents to disclose their health information. And because of this, best practices to protect your staff and other residents, managers must communicate with staff and residents that policies have changed. Sanitizing work surfaces, public places, and commonly touched surfaces like door handles and elevator buttons, very important. Leave that hand sanitizer out in the common rooms like the laundry rooms. Maybe limit the number of people that are in your laundry room. It's possible that you're only responding to emergency repairs, and that THD, of course, will support you on this. We are still investigating housing complaints, mostly by phone calls. And if we received one from your facility, we'll call and talk to you about that, and we can discuss if it's an emergency that needs to be taken care of. So these are the big 10 housing violations that I talk about when I talk about an emergency type situation. So these are the violations that can really affect your residents' lives, affect their health. So surfacing sewage, this is one where whenever we receive that complaint, we stop what we're doing and we immediately respond. And we have a 48-hour correct by date for surfacing sewage. This is like public health 101. You can't have sewage running through the streets. So other important violations are no water service, no hot water, inadequate heat. Thank goodness we're outside of the winter time, except for this little cold blast that we're experiencing right now. But minimum temperature in livable spaces is 65 degrees. And it's not just any heat source, it's safe heat source. So no stoves, whether it's electric or gas, no space heaters, especially plugged into extension cords. We want to make sure that heat is safe heat. For air conditioners, if the unit is rented with air conditioning, it needs to be maintained. So if a home or apartment is rented with air, central heat and air, and it goes out, it cannot be replaced with just one window unit. That's not the same. And for fire protection, this is very important in apartment complexes, right? We want to make sure that smoke detectors are working. that the windows are easily opened, and that there are no barriers for egress. So I took that little side note to go over my important Big 10 violations. So more ideas on how to protect your staff. Communicate with residents which ideas you choose to put in place that fit your apartment complex. So not all of these ideas will work for everyone, and you all might have some others that are better than some of mine. So you could share that with everyone in the comment in the chat section. Limit in-person contact between the staff and the residents, of course. Limit resident gatherings and closing fitness centers and community rooms. Continue, of course, you can continue your move out walkthrough inspections, but follow social distancing guidelines. You may have to consider doing virtual tours to potential residents. If that's not possible, of course, social distancing and sanitizing in between showings. So another aspect to protecting privacy is for the residents and the employees is if your property managers or your owners know that an employee or a resident has COVID or is experiencing symptoms, so they've just volunteered this information, you didn't require it. This info cannot be shared with other residents or staff. Like no blast email that says apartment 227 is under quarantine because this is what is going on in their life. That's not what you can do. You have to protect that information. You can tell people like we're avoiding this area, but not specifics on why, of course. And a smart policy is to assure or is to assume that everyone is sick or asymptomatic to prevent spread. So just treating everyone the same is the best policy for you and your staff. Because apartment communities are likely to have residents who need to self-quarantine, to protect your staff, we recommend that you suspend routine maintenance and inspections until this passes. This means only entering apartments for emergencies. So, and we've talked about those Big 10 violations that the health department sees as an emergency. And use precautions to protect staff if they do have to go into an apartment because of an emergency. Clean and sanitize common areas. If you have to deliver a package to a resident, you can make maybe a phone call and make an arrangement to leave it outside of the apartment, and then they can take it into their apartment themselves so that you don't have to come in contact with them. So for scheduled pest control treatments, because you have some type of an infestation and you need to stay on top of that, so that would definitely fall under an emergency. Communicate with your vendor and the resident. So if someone's sick, you may avoid that apartment without actually saying, what's going on. If you offer trash side pickup, that can continue, of course, using gloves and washing hands. And one thing about supporting residents, it is very stressful for everyone, especially the resident. And Oklahomans are very caring people, and the health department encourages us to check on our neighbors, that check on the apartment staff, see if they need anything. But please remember to use safe common sense practices whenever you're making contact with residents that may be sick. So I did have a question about which cleaners to use, and over-the-counter products, of course, are fine, but please read the label and use those products according to the label. It is very important that if you use bleach, that you follow the directions. So more bleach is not better. 1/3 of a cup of bleach to a gallon of water is a diluted solution that's safe for disinfection. And of course, don't mix ammonia and bleach. And we want you to clean and disinfect often. If you have gloves, then of course use them, but this doesn't take the place of the importance of hand washing, before you put the gloves on, after you take them off, or anytime your hands may have become contaminated. So for additional information, I did reach out to Tulsa Housing Authority, and HUD has postponed inspections until further notice. You can contact them for more information about this. And the Tulsa Health Department is still investigating complaints for any complaint that we get, but we're definitely focusing on those major violations. So heating and air issues, sewage, no hot water. We're trying to handle most of these by phone so that we're not going into homes and potentially making people sick or exposing ourselves. If you have any residents that are experiencing difficulties, we of course refer them to 211. And again, Away Home for Tulsa, that's the AWH4T. We're having a landlord rights presentation tomorrow during this COVID-19 situation, and it's tomorrow at 10 a.m. and you can pre-register for that, just like you did today. And they'll be able to answer questions about non-payment and evictions, and connect you with help for the owners that are hard hit financially by this crisis. So to stay up to date, you can visit our website. You can sign up for our public health emergency preparedness email list, and we send out updated emails with what's going on in the area. Oklahoma State Department of Health has a 24-hour call center, and the Tulsa Health Department also has one that you can reach during normal business hours. We're definitely there to help you work through any situations that you may have. So now that I've talked about how to reduce the spread of COVID in apartment complexes, and now I want to discuss why we have a housing code and how housing violations can cause serious health issues. So you see that we have hazards that cause health issues, and some of the health issues that people experience when they're living in unsafe housing situations. So normally whenever I talk about housing, I talk about, because we live in Oklahoma, a natural disaster. So we've all lived through a time when we didn't have electricity or water because there was a tornado or an ice storm. And if you think back to that period of time, how stressed you were, wondering when you were going to get electricity back or water. And I just want to share with you that there are people that live in our community, Tulsa County, Oklahoma, that live in that stressful situation every single day, and that stress affects their health. Some of these, of course, are caused by the tenant, like smoking and not cleaning like they should. But some of them are caused by situations where owners don't fix things. And fortunately, in Tulsa, we have by far more people that own rental properties and manage rental properties that do the right thing. Things go wrong, heaters break, they're fixed as soon as they can possibly be done. And at the Tulsa Health Department, we completely appreciate all of those owners that go the extra mile to keep their properties up to that safe standard. So anytime I'm out there doing education for tenants, I'm mostly focusing on the tenants that are living in unsafe situations. The Tulsa Health Department is here to support both the owners and the tenants, to do education, to help train landlords and property managers and renters on what a safe and healthy home looks like. We do have this program, and you can find out more information on our website at tulsa-health.org/housing. We have a renter walkthrough inspection. We conduct free courtesy inspections of rental properties. We're there to sort of mediate in between the two. The way that we conduct our inspections every single day is we strive to hear both sides of the story. We know that there's two sides to every story, but at the end of the day, we want those violations fixed so that we all have a safe and healthy home to live in Tulsa. So if you have any more information about this program, you can contact me. And here's my contact information. A lot of times my housing presentations are a lot longer, and you can access my full Housing 101 presentation on our website. Of course, Housing 101 was canceled for April because of the COVID-19, but hopefully we'll get that rescheduled soon. And until then, I have these Zoom meetings that I can help spread the word about safe and healthy homes. So that is all that I have for today. If anyone has questions, Kristen um, will help with that.
Thank you, Kendra. We haven't had any questions asked so far in the chat, but if anyone has any they would like to ask now, this is your opportunity. Okay, it looks like we don't have any new questions. Thank you to everyone who submitted questions earlier. So we could, sounds like we were able to cover all of the concerns. Oh, we do have a question.
Oh, okay.
The question is a landlord or property manager allowed to ask if a resident has any symptoms, or would that also be a violation?
Yes, you cannot ask if they have symptoms or been diagnosed. That is their private health, just like, you know, fair housing and other situations that we come across, whether it's a disability or some type of other illness. You cannot ask. They can volunteer that information, and you can protect that information, but you cannot ask that question.
Thank you, Kendra. We also are in the process of planning a more extensive fair housing presentation similar to this, where we will address questions like that. But we will also be explaining that if a fair housing violation occurs, how to make a complaint and what an investigation looks like and what the outcomes are. So stay tuned. We will continue to bring presentations to address concerns like that. We have another question. Is a landlord of a rental house allowed to shut off utilities due to non-payment of rent?
Oh, it says I'm muted. Am I muted? No, I'm not muted. Okay. No, you cannot. You cannot shut off utilities. We have had this question several times. If they don't pay, you cannot shut off utilities. And the entire time that that person lives there, you are required to provide those basic utilities, electricity, water, gas. That is not a way to force out an eviction.
All right, we have another question. If a landlord does turn off the water for non-payment of rent, who should the tenant contact?
You can definitely contact the Tulsa Health Department, and we will do our investigation, contacting the owner, sending our orders. The Tulsa Health Department does have the ability to issue citations in the city. We can issue citations, and that is a ticket to go to court. We are not going to be this is a difficult situation for everybody, and this is not the proper way to remove people from properties.
I will also add that if you have had your utilities turned off, or you've been threatened with cutting off your utilities, or any other kind of lockout or unlawful eviction, you can call 211 and be connected with legal resources that can advise you of your rights and offer you solutions.
Thank you, Kristen.
Do we have any other questions? Okay. With no other questions, thank you so much, Kendra. This has been a wonderful presentation and addressed a lot of concerns and a lot of questions I have certainly heard over the last week. Thank you everyone for attending. We will be making this recording available online. So for those who were unable to attend, feel free to share this with them. Thank you very much.
Thank you.